Hi, my name is VirginiaBarron, and the disease that I'm going to be talking about is multiple sclerosis. In this PowerPoint, I'm going to talk about the anatomy, physiology, pathophysiology, diagnosis and symptoms, treatment, artificial intelligence, demographics, and at the very end, I'll list all of my references. Anatomy. Multiple sclerosis is a potentially disabling disease that attacks the brain and spinal cord, which is combined, it's called the central nervous system. The immune system attacks the myelin sheath that covers nerve fibers and causes communication problems between your brain and the rest of the body. After a while, MS may cause permanent damage or deterioration of the nerve fibers and eventually cause people to have serious cognitive issues. And on the side, you'll see a picture of what the central nervous consists of. Physiology. The central nervous system is the body's command center. It is made up of the brain and spinal cord. The brain controls how we think, learn, move, and feel. The spinal cord carries messages back and forth between the brain and the nerves that run throughout the body. Pathophysiology. So, MS is an autoimmune disorder of the central nervous system in which T lymphocytes attack the CNS, causing lymphocytes and monocyte-derived macrophages to enter the brain and target the myelin sheaths, causing inflammation, demyelination, gliosis, and neuronal loss. And on the side here, we have a neuron. We have a healthy neuron, and next to it we have a neuron that's been affected by multiple sclerosis. In the picture, we can see how the Schwann cells, how they're deteriorated, and it actually exposed the fibers. Symptoms and diagnosis. Some of the symptoms of multiple sclerosis include numbness or weakness of the limbs, and it's usually one side at a time. It's usually not both sides together. Tingling of either the feet, the toes, the arms, sometimes the face. Electric shock sensations when they move the neck. Lack of coordination, blurred or double vision, slurred speech, and cognitive problems. And diagnosis, there is no specific test that diagnoses multiple sclerosis. Usually diagnosis is done by ruling out other conditions that might produce similar signs and symptoms. This is called a differential diagnosis. They'll usually start by getting a spinal tap and an MRI of the brain. Treatment. Again, there is no cure for multiple sclerosis. Once they get it, they're gonna always have it. But treatments usually include speeding recovery from the attacks that have already been done to the neurons, slowing down the progression of the disease, and managing symptoms. There's a lot of oral medications, injectable treatments, and infusions. So I just listed one which they said that it's the most common one that's used. So for oral treatment, diroximel fumarate is usually a pill that they take once a day. And then they have an injectable treatment. It's called interferon beta medications. And infusions, usually they'd give them monoclonal antibodies, and they have different types of infusions that do have that type of antibody. And other medications that are prescribed, they're usually prescribed to reduce depression, fatigue, and help with bowel or bladder control problems that are associated with MS. And the picture here, it shows you the type of injectables that they have for MS, and then next to that they have the pills, the ones that they take orally, and then the last one are the infusions that are available for either to help them ease either with the symptoms or to help slow down the MS. Artificial intelligence. In the UK, a project named Assist MS is studying whether artificial intelligence can be used to detect and highlight changes on the brain using MRIs. An algorithm software called IcoBrain MS is able to detect lesions in the brain, measure brain volume, and report on how they change throughout time. Artificial intelligence was able to correctly diagnose MS in a study conducted with 100% accuracy. And so they did that a few times, and they kept getting 100% accuracies, but they don't feel comfortable releasing that to neurologists yet, but so far it's looking good. Demographics. Most common, I'm sorry, the people that are most common to get MS are women from the age of 20 to 40 years old. It can happen to anybody, all ages, from kids to older adults, but the most common are from 20 to 40. And the ethnic group that it occurs to the most is white women. It's not an inherited disease, but there's still a 1 to 3% chance of developing MS if a parent has it. Men can get it too. It's just it's a lot. It's not that common. And right here on the picture, there's a graph that shows the age that's the most popular, and then underneath it says that MS is higher farther from the equator on the map. And yeah. And here go my references. These are just my regular references. These are my picture references, and I hope you enjoyed my presentation. I hope you learned from it, and thank you very much. Have a great day. Thanks.